On the show today, we'll focus on the development strategy of the Bill and Melinda Gates Foundation for Africa this year. As always, you can join the conversation with the hashtag Beyond Markets. You can follow my Twitter handle too at Esther Ugbodaga. And the former world's richest man and the co-chair of the Bill and Melinda Gates Foundation, Bill Gates, says for Nigeria to lay a foundation for sustained prosperity, the government needs to invest more on healthcare, education, and opportunities for the average citizen. I caught up with Chris Elias, president of the Global Development Program of the Bill and Melinda Gates Foundation, and discussed the foundation's development strategy for Africa. Let's start with you talking us through what exactly the Bill and Melinda Gates Foundation does here, the work that you do here in Africa.
So, the Bill and Melinda Gates Foundation is a big international philanthropy headquartered in the United States. We're about 18 years old, and our mission is to try to help partner to ensure that everyone has an opportunity for a healthy and productive livelihood. So we've been working in health issues as well as financial inclusion, agricultural development for much of the last 18 years. And our focus has naturally brought us to Africa because when you look at some of the challenges in terms of health from malaria and other problems, many of them are concentrated here in sub-Saharan Africa. And so we've been working in Africa really since the beginning. But in the last 5 years or so, we've really increased our efforts in sub-Saharan Africa. About 5 years ago, we opened our first offices in Africa. We have 3 offices in Ethiopia and Nigeria and South Africa. But we have activities that we support in partnership with other philanthropies, with governments, with civil society, the private sector, really in most of the countries in Africa.
So what is the strategy, especially for a country like Nigeria?
Yeah, there are several. So in health, we work on some of the most common causes of maternal and child mortality, trying to reduce that mortality. Africa has made a lot of progress in reducing maternal and child mortality, but still has a ways to go. In agricultural development, our focus really is primarily in Africa because most of the rural population of Africa make their livelihoods in agricultural development. And so improving the tools and methods by which smallholder farmers can increase the yield and get the most out of their agricultural livelihood is an important priority for us. And then also we've been working on financial inclusion, using digital financial services to help bridge that gap in terms of access to banking and other financial services. So we work in many countries in Africa, and in Nigeria, which is where we have our largest office in Africa, and where we have our largest programs. We work in all of those sectors. So we have a large range of collaborations in health, working on polio eradication, on increasing routine immunization, strengthening the primary health care systems, and a range of other health issues, particularly nutrition, where we're trying to improve the nutritional status of Nigerian children. But we also work in agricultural development and financial inclusion here in Nigeria as well.
Talk to us about the partners that you collaborate with here, those who actually work on the ground.
So, we work with a range of partners, and that's one of the advantages of a philanthropy, is that we can partner with governments, we can partner with private sector, we can partner with UN agencies, with civil society, et cetera. One of the unique and important things about our work here in Nigeria is that much of that work is done in partnership with the foundation that Alhaji Aliko Dangote runs. And having a strong philanthropic partnership with the Dangote Foundation here in Nigeria has been part of the success of our collaborations. So about 2 years ago, in partnership with the Dangote Foundation, the Bill and Melinda Gates Foundation announced a $100 million joint commitment to reducing malnutrition rates here in Nigeria, focused mostly on 13 states in northern Nigeria where the malnutrition rates are highest. In addition, we've partnered with them and 6 northern states on strengthening their routine immunization system, which is critical to making sure that polio is gone from the African continent. It's been 18 months now since the last case of polio anywhere in Africa. And ensuring that success requires building a strong immunization system.
On the issue of the primary healthcare, especially primary healthcare, when I look at the numbers, they're not too encouraging. And I think about the numbers that I saw 5 years ago, and I say to myself, they don't look too different. And I know that it's not just the Bill and Melinda Gates Foundation that's here. There's so many other foundations, NGOs, who are working, round the clock to ensure that we get the numbers are better, and that those remote rural areas have access to this very basic, especially primary health care. And I'm wondering, what is that one challenge? Is it, I don't know, is it the cultural beliefs? Why are the numbers not improving significantly?
So I wish it was just one challenge, but it's actually a set of interlocking challenges. We've been able to make progress in things like polio eradication by being very focused on specific interventions to address a particular disease. But if you want to improve the lives and health of women and children in a sustainable way, you really have to build the system. And the primary healthcare system is really the basis for that success. 80 to 90% of all the problems can be either prevented or treated at the front line of the primary healthcare system. And yet the primary healthcare system in much of Nigeria and in much of Africa is under-resourced. It's under-resourced from a financial perspective. It's also under-resourced from a human resources perspective. There's not enough healthcare workers, nurses, midwives working in the system to reach everyone. So this is part of the collaboration we have with a number of the state governors and the Dangote Foundation to try and build that system. And it requires attention to a variety of things. It requires understanding how many health facilities you need and where they should be. It requires understanding how many health workers you need and how to have them in place, showing up for work, doing a good job, and being paid. It requires having the drugs and vaccines available, so building the supply chain and logistics to actually make sure that if someone walks 5 kilometers to a clinic, that there's somebody there and there's something there to provide the treatment that they need. It also requires financing. And that's particularly challenging in a setting where there's not enough resources in the health sector in general.
But you see the government making a bigger commitment from the financing perspective, because with these things, it's often said, and I think it's often said that the leaders should take ownership of the problem, and they should be the ones to lead. And then we can have the private sector, foundations like Bill and Melinda Gates Foundation, following suit. Would you say that is what is happening now? Are we taking lead?
I think you're right that in the end, the government needs to lead. The Dangote Foundation, the Gates Foundation can be partners, can provide flexible resources, the means for innovation and experimentation. But in the end, our resources are small compared to the government's, and we're never going to be able to support the system. The government has to support the system. And I think that there's very strong interest in doing that. I was at the National Economic Council yesterday with Bill Gates, and he gave a speech there, which was, I think, very well received by the Vice President and the Executive Governors who were there, about the importance of investing in human capital development, investing particularly in education and health. Because one of the things he said was, a country really can't work without roads and ports and other infrastructure. But the reality is that infrastructure can't work without skilled people who can run the ports, et cetera. So, the investments in health and in education and in livelihoods for young people are quite important in terms of driving economic growth and in terms of realizing the ambitions in terms of reducing mortality rates for women and children. It's a challenge here in Nigeria because one of the things that we discussed yesterday at the National Economic Council is that Nigeria has the lowest revenue to GDP rate in the world at about 6%. The next lowest is Bangladesh at 10%. If Nigeria were able to go from 6 to 10%, they would add $18 billion to the government's budget to spend on things like education and health and the social sector. That human capital development really drives development. You need to complement it by investments in infrastructure and industries, et cetera. But you need the people to actually drive that success. And
on the issue of the revenue to GDP, the foundation has actually offered to assist at the state level, governors for in the area of revenue mobilization. Tell us how that's going to be done.
Well, we're not. I think
Well, that's what Mr. Gates said yesterday.
Well, we're gonna provide technical assistance to understanding those mechanisms. We're not going to do the revenue mobilization ourselves, but I think that there are lots of lessons to learn about how this is done. It's hard to do, right? Raising revenue is difficult, and there's sort of a chicken and egg problem, right? That it's hard. It's a tough proposition to suggest that you need to raise more revenue when the current performance of the system is weak. It's what Bill Gates described yesterday as a low equilibrium. What we need to do is get to a higher equilibrium. We know, and there's good experiences, that if you raise more revenue and you invest it in human capital, that is, if you put that additional revenue to good use, that has tangible benefits to people in terms of the improvements in their health, the improvements in their educational attainment, ultimately their jobs and livelihoods, you create a virtuous cycle where you move from a low tax, low performance situation to a higher tax, higher performance situation. And that's the path that I think that there's commitment to go down, and we're happy to be technical partners with both the federal and state governments in that.
Okay,
area.
now to give flesh to all of that, that is why the government has put in place the Economic Recovery and Growth Plan. And of course, within that, one of the key 3 pillars is human capital development. And of course, I mean, if we prioritize it, and put enough the required funding and commitment and urgency that it deserves, obviously we'll see that happening. Are you hopeful that going forward, we will begin to see the traction that we need in human capital development? Because I know that the Gates Foundation, you say you will continue to work very closely with the government. You already have a strong relationship with both the federal and state governments and many NGOs here. But are you hopeful that going forward, we can begin to see those numbers improving?
Yes. I mean, I think that you can see, after Bill's speech yesterday at the National Economic Council, there were very welcoming comments from a number of the state governors as well as from the vice president. As you say, the Economic Recovery and Growth Plan includes as one of its strategic objectives investment in human capital. So this is very much aligned with the aspirations of the Nigerian government. So we're happy to partner, and what we've seen is where you bring the best of the technical expertise, because again, these are difficult systems improvements. It's not a magic bullet. So we're happy to bring our experience from other countries, from the world's technical expertise, to partner to help Nigeria reach those aspirations.
Let's talk about your portfolio. You oversee the global development portfolio in areas such as agriculture, development, and financial services for the poor. Let's talk about agriculture. Now, for Nigeria, it's all about the rural farmers who live in the rural areas and their smallholder farmers. And many of their challenges include, especially, access to credit, good seeds. But we know that that is actually changing. I've seen the numbers, and they're actually improving. But would you tell us how you're supporting this, some of the initiatives, what yours is, and how you can also help improve the numbers?
Yeah, our agricultural development program, which is one of our largest programs, is really focused on smallholder farmers, how to help the people who live on 1 acre or less and derive their livelihoods from it to succeed. Now, to do that, they need a couple of things. They need to have the best possible inputs in terms of more modern seed varieties, access to fertilizer, et cetera. So, access to the agronomic expertise to know how to use them to maximize their yields and to protect their crops from threats. So, we actually have a big research agenda. We do a lot of collaborative projects with the International Institute for Tropical Agriculture in Ibadan, where we're trying to understand how to protect some of the crops that are most critical to smallholder farmers in Africa, like cassava, from threats from viral diseases that often can destroy the crop. So our focus in agriculture is both on crop protection as well as increasing the yield of the crops. As you say, one of the key elements is for farmers to have access to credit. And this is where there's an important synergy with the financial inclusion. So, helping farmers access financial services, including savings as well as credit and receiving things like fertilizer vouchers for the poorest through their digital devices, so that you make sure that they're reaching the direct beneficiaries of the program, is something we've seen in other countries has been a really important way to help the smallholder farmers.
Well, is there monitoring? Do you have targets, timelines to say, okay, this is these number of farmers, smallholder farmers, we want them to have X, Y, Z by this time and see this level of improvement in the next 6, I don't know, whatever timeline that requires?
Yeah, so typically all of our strategies have sort of aspirational, what we like to think about as ambitious but achievable goals. And we then often, usually, almost always, put in place the metrics to assess progress against those goals. Targets are a tricky thing, because if you set a target, then you create an incentive for people to sometimes fudge the data. So an interesting thing, we saw a different sector, but in immunization, earlier this week in northern Nigeria, we've taken the approach of getting rid of the immunization targets. And what that's resulted in is better, more accurate reporting. And so even though the numbers came down, we're more confident in them, and that lets us understand how to drive the system performance. Sometimes targets result in ambitious reporting. So we have goals, and we have metrics to measure progress against the goals. But in general, we try to avoid setting some specific target that may make it actually hard to measure progress toward that target.
That was Chris Elias, President of the Global Development Program of the Bill and Melinda Gates Foundation. If you're just joining us, today's discussion is on the Bill and Melinda Gates Foundation's Africa Development Strategy. Now, I caught up with the President of the Foundation's Global Development Strategy, Chris Elias. Thank you, Chris, for your time so far.
Sure.
Let's talk about the micro, small, and medium enterprises in the country. There are about 37 million of them. But then there's still issues around digital payments that they can benefit from, and you've spoken a lot about that. Tell us how the foundation is assisting in this regard.
So our financial inclusion team is really focused on how to use the revolution in digital technology to create greater access. And we work in 8 or 9 different countries, including here in Nigeria. And the potential of digital access, when you have a continent that now 75% of people own a computer on their phone, a very powerful computer that can handle tremendous amount of data transfer quickly and safely. So if you can use that technology, which people already have for the purposes of communication, you can tap that to help them simplify their financial life. To bank over the phone, to pay over the phone, to receive payments over the phone in a secure way. So it increases the safety rather than carrying around large amounts of cash. And it helps to, in the case of the government to people payments, it helps to ensure that the beneficiaries are the ones actually receiving the payments. So to do that, you have to build a digital financial system that gives everyone access. And one of the advantages, again, of this is that we're trying to close the gender gap in access to banking between men and women. Still lags, but is beginning to close a bit. And so we can use digital technology as a transformative way of trying to provide financial services. It often begins as people-to-people payments, that I have, I can send you cash from my phone to yours. It can also allow governments to send payments for cash transfers to people in a secure and targeted way. On that, you can then build banking services and include the savings, opportunity for savings in a more secure way, et cetera. And then ultimately, other more complex financial services, credit, insurance, weather-indexed insurance for smallholder farmers, et cetera. There's a whole set of applications of financial services that can be built on a secure digital financial services platform. And so that's one of the things that we've been working with here in Nigeria, working with the central bank, as well as the broader financial services community.
How would you assess the progress that's been made so far?
Well, I think that there's important progress. I think that one of the tricky things, and it varies a little bit from country to country, is getting the regulatory environment right. So that how do you create the right regulatory environment for the banking system and the mobile network operators to work together on a comprehensive digital financial services partnership so that each one is playing an important role.
Now, central to any country's economy is the ability to generate revenues. And I know that yesterday in Mr. Gates' speech, you talked about, like we also talked about earlier, the percentage of revenues to GDP. Many African countries, especially Nigeria, the ones that are that are mono economy dependent on commodities, like especially oil, that's quite volatile, that may continue to be a problem even in the coming years. I mean, there's several forecasts about where oil prices will be or not be, as it were, and we talked about taxes, the fact that, I mean, you put out low services, you get low taxes in return. And I'm thinking that is a cycle that many countries have found themselves in. Mm-hmm. So what are your thoughts on these countries breaking out of that and the ability to begin to say, okay, we're going to be more proactive, maybe tax collection, or at least providing basic services for the people so that they have a change of mind and heart and say, okay, we'll pay the required taxes?
Yeah, so I think, as I mentioned before, it's really a matter of, it's kind of a chicken and egg. You have to build the confidence in the system for people to feel like they're getting a return on the taxes they pay. And so that's, it's a sort of, you have to build both sides. You have to build the revenue generation, but you also have to deliver. And one of the things that I think is important in that regard is to look for some of the low-hanging fruit. So, a lot of the work that we've been doing here in Nigeria with the government of Nigeria and the Dangote Foundation as partners has been focused on improving childhood immunization. And there's an opportunity for quick returns. Right now, only about 25% of Nigerian children get the full range of vaccines. If you could get to 80%, you would reduce child mortality in half. Nigeria currently has the largest number of children, unimmunized children in the world. That's an opportunity. And about half of the child mortality is due to vaccine preventable disease. So if you can better finance the immunization system and deliver it to children, you'll quickly see a reduction in child mortality from measles, from pneumonia, from other preventable diseases. Vaccines are sort of, almost like magic, right? You can give 1, 2, or 3 shots and protect a child for life. So and this I think was part of the point of Bill's speech yesterday, as the government seeks to diversify the economy and invest in human capital as per, the Economic Recovery and Growth Plan, if they take those increased revenues and invest them in places that people will see quick benefit, that helps to build the confidence that the increased revenue is being well spent.
Now, in the countries that the foundation works in, especially here in Africa, would you see a change in a greater commitment? Do you see that political will? Because we often talk about that. It's one thing to know what to do. It's another thing entirely to actually do it, even when funds many times are available. I mean, we talk about issues about corruption, leakages in the system, and all of that. But do you see that changing, or are you just hoping that that would change so that it makes your job a lot easier, as it were?
Yeah, well, I guess the first thing to say, it's not my job, right? We're a partner, right? We're very interested in helping Nigeria achieve its development goals. Those are Nigeria's goals, not ours. And that partnership is a very strong one, and we're happy to see the progress we've made. As you say, one of the strongest determinants of progress is the political commitment, followed by the financial commitment. Because you can't run a system that has no resources to run it, that doesn't have the resources to pay salaries of health workers, et cetera. But the financial commitment doesn't come before the political commitment. So strong political commitment at the federal level as well as at the state level. And we work with quite a few states in Nigeria. And the ones that are moving fastest are the ones where you have the strongest and engaged political leadership. So I think that there is a strong intention, and we're very happy to be together often with the Dangote Foundation, a partner with the government in realizing those aspirations.
Now, outside of Nigeria, briefly tell us about some of the successes in the last 18 years or maybe the last 5 years that the foundation has recorded.
So I think one of our biggest successes, and it's a story that's relevant to Nigeria, but also quite a few other countries in Africa, is that back at the beginning of the foundation's history, when it was founded in 2000, shortly after that, we realized that there was an epidemic disease that occurred seasonally in Africa that was devastating to people, their families, and their communities, and the health systems, and that was epidemic meningitis. When we looked at the case of epidemic meningitis back in 2001, we realized that there was a unique strain of epidemic that caused seasonal outbreaks in northern Nigeria and the other 23 countries in what's known as the meningitis belt that begins in Senegal and it goes across the Sahel to East Africa and down into Congo. And we looked at the science and we realized that there was science to solve this problem, but that science had not been applied to develop the solution, the vaccine, the meningitis A vaccine that was needed in West Africa. So we made an important investment, a $70 million investment, in a public-private partnership to bring the science from academia and government into private sector partners. We work with a range of partners, private sector partners, including in particular the Serum Institute of India, that took 9 years to develop a vaccine, which was introduced first in Burkina Faso in 2010. And since then, with funding from the Gavi Vaccine Alliance, has funded the rollout of that vaccine across West Africa. And now, you don't find a case of meningitis A. There are still other kinds of meningitis. Nigeria had an outbreak of meningitis C last year, and we're now investing in a vaccine that would cover all the kinds of meningitis. But meningitis A, which used to be a devastating public health problem, and not just to the people affected, but it was also one of the main reasons people across the Sahel were being driven into poverty, was taking care of loved ones who got meningitis. That public health problem is gone. There are still other problems to address, and we're going to take that same technology and apply it to the other types of meningitis. So we're not done, but the achievement in terms of alleviating one of the most dangerous and threatening and scary forms of epidemic illness in 23 countries in Africa has been solved through bringing together, and this is the key thing, the science was there. We didn't have to, in that case, discover new science. We had to bring that science to application for Africa. And that required working with the private sector, because that's where the innovation, the capability, and vaccine manufacture rests. But we needed to work with them to share some of the risks, to underwrite some of the development costs, to make it possible for a company to make a vaccine that could solve a big public health problem in Africa. That's probably one of our largest successes on the continent.
Chris, thank you so much for talking to us. We'll leave it there
Thank
today.
you, Esther.
Thank you. That was Chris Elias, President of the Global Development Program of the Bill and Melinda Gates Foundation.